Welcome, everybody. My name is Larry Hoffheimer, and I am the chairman and founder of the Macular Degeneration Association. Although we are the Macular Degeneration Association, we sponsor these webinars on all aspects of eye health. Today, we have a very interesting speaker who's going to talk about general health and eye care. Before I introduce him further, I'd like to tell you a little bit about the Macular Degeneration Association. I founded this organization about 12 years ago in light of the fact that my mother had wet macular degeneration and lost her entire central vision. In those days, there was very little treatment for it, and unlike today, but the frustrations ran heavy because she lost her ability to read, watch television, and it really affected the quality of her life. Today we have it's kind of a new paradigm on how to treat macular degeneration. But in that, our goal at the Macular Degeneration Association, which is a charitable 501c3 nonprofit foundation, is to educate the general population, particularly patients, about the future of macular degeneration and other eye disorders. Today we have Dr. Kerry Kelp, who has spent the last 3 years traveling Europe, producing a feature-length documentary known as Open Your Eyes. It was released in 2020. Upon its release, he launched the Open Your Eyes podcast that delivers weekly episodes focusing on all aspects of ocular health. He frequently lectures on the diagnosis and treatment of macular degeneration, glaucoma, and diabetes. Dr. Kelp graduated with honors from the Illinois College of Optometry and completed 1-year residency in the diagnosis and management of ocular disease. He has been practicing in New Jersey for the past 23 years. He currently resides in Union County with his wife and child. It's now my distinct pleasure to introduce to you Dr. Kerry Kelp.
I'm really excited to be here. I always love talking to the public about my passion, which is ocular nutrition and wellness. And I think that over the next 45 to 50 minutes, the people in the audience are going to learn a lot, and I'm going to make sure that we have a take home for everybody to help to decrease their risk of this terrible disease. So let me just get that. And okay. I am a board member of the Ocular Wellness and Nutrition Society. I'm the president of AllDocs, which is an organization of 500 doctors plus, LensCrafters, sublease doctors, and also the name of my office is Contact Lens and Vision. I practice in Woodbridge, New Jersey, and I still actively see patients. This is the film that we produce. It's called Open Your Eyes. It took about 3 years to do this. The film looks at my journey of how the eye is related to systemic disease. There's close to 300 systemic diseases that could manifest in the eye. And we talk about that and also prevention. And here are some pictures along the way that when we were filming the movie. I was at NASA. We were in Toronto, where I interviewed Jason Fung, who's written a number of books on health, and my heart is in Nicoya, Costa Rica, with the centenarians. So the Americans spend about $34 billion per year on supplements, and about 77% of Americans in 2019 take a supplement. It's probably a lot higher now because of what we've been through with COVID. Now, one of the interesting things is that there's about 2.5 million studies that are done each year. And the average physician takes about 17 years before research of these great studies used in clinical practice. So that's one of the disconnects. Sometimes there is new research, but your doctor doesn't know about it. So when you're going to see your doctor, whether it's your eye doctor or any type of doctor, they're not always up on the newest research, which of course is difficult when there's 2.5 million studies that are done every year. So the eyeball, I always say, is connected to the eye bone is connected to the toe bone, because the eye and the rest of the body is all related. We think that we go to the doctor and we go to the urologist, or we go to the cardiologist, and we go to the oncologist and the optometrist, and that we think that all the body isn't connected, but the body really is connected. So typically what affects one part of the body will affect another part of the body. And this was a study that was done in 2019, and it said about 1/5 of the deaths around the world are associated with a poor diet. And a poor diet is really processed foods, and we're going to get into it a little bit more. And United States was 43 on the list. I thought we would have been a lot worse. China was among the worst at 140. So what is the issue here? The issue is that in the US, 63% of our food is processed food. So what is processed food? Refined grains, sugar, processed oils, and added fats. About 50% of Americans will suffer from some eye disease at some point in their lifetime. And 80% of the blindness is from macular degeneration, diabetes, and glaucoma. Macular degeneration and diabetes are nutrition related, and glaucoma is preventable if you see your doctor early enough. And there's some early indications, but not as strong as diabetes or macular degeneration, that it's related to nutrition and health. The number one cause of blindness over the age of 55, maybe over the age of 50, is macular degeneration. Under 50 is diabetes. There are about 15 million people in the US who have macular degeneration. That statistic, it fluctuates all over the place, but pretty much I would say it's about 15 million people. 3 to 4 million people have advanced macular degeneration. That means that they're blind in at least one eye or both eyes from either wet macular degeneration, like Larry's father had, I believe it was his father, or a type of dry macular degeneration called atrophic atrophy. So 10% of macular degeneration is wet, and 90% is dry. Dry happens before wet. So if you could pick up dry early, we could do things to really lower our risk of getting wet macular degeneration. And I see there's some questions, and I will answer the questions at the end. I might answer them as I'm speaking. But most of the blindness that we have is from the wet type. So 2/3 of the blind, 90% of the severe vision loss is from wet macular degeneration. And about 450 people go blind each day in both eyes from macular degeneration worldwide. And the person who speaks about that a lot is a friend of mine named Chris Kenobi. He's a ophthalmologist who stopped practicing ophthalmology to find the cause of macular degeneration. And he feels from all his research, and his research is very compelling, that the cause of macular degeneration is processed foods. And the processed foods that he talks about are polyunsaturated fatty acids or refined oils, because as I said, 63% of the American diet consists of 4 refined nutrient deficient processed foods that didn't exist before the year of 1880. And so the other 4 main ones are trans fats, refined flour, and sugar, but he feels that polyunsaturated fatty acids are the worst. We consider him like today's modern Weston Price. For those that are interested in nutrition and health, Weston Price was a dentist back in the 20s and 30s who visited different cultures to find out what their health was like and what their teeth was like. And he found that cultures that went away from their traditional cultures had much more disease. Dr. Kenobi states that displacing foods of modern commerce, in other words, processed foods, are the primary and proximate cause of macular degeneration. And he feels that you could prevent and may even be able to treat macular degeneration with ancestral diets. And here's his paper in Medical Hypothesis, where he explains it quite thoroughly. There's thousands of studies that have linked processed foods with Western civilization. So before 1880, we didn't have heart disease. In fact, the first cardiologist, if you try to look it up, wasn't until 1920. So all these diseases run together. So back in the late 1800s, we didn't have cardiovascular disease, cancer, stroke, Alzheimer's, macular degeneration, cancer. This all started with processed food. And anybody could take a look at what that is a picture of. And I know you can't answer me, but I always like to put this in my lectures. And this is an oil refinery, but a vegetable oil refinery for polyunsaturated oils, not oil that you would use to run your car. So there have been 10 studies that have correlated macular degeneration with vegetable oil consumption and trans fats. I did a podcast with Dr. Kenobi. I invite you to watch that podcast. He goes over his research, and it's really terrific. There are more people in the US that have macular degeneration than breast cancer, prostate cancer, Parkinson's disease, and Alzheimer's. But unfortunately, we don't hear enough about macular degeneration. And now, over the next 50 years, 1 in 10 people over the age of 60 will have macular degeneration. So we need strategies to prevent and detect this horrible disease, not only for preventing blindness from the poor person that comes down with macular degeneration, but also the burden of the families taking care and society taking care of these people. As eye doctors, we have many different instruments to help us to diagnose macular degeneration sooner. This is a picture of some of the technology that we're using. In the middle, you might have heard of OCT. OCT is ocular coherence tomography, and it's a light technology that could tell us if the macula is swollen. But there's next to it is a retinal camera, which could pick up early signs of macular degeneration much earlier than OCT. Now, macular degeneration should be considered a vascular disease, a systemic vascular disease, not just an eye disease, because people with macular degeneration also have chronic disease, such as cardiovascular disease, hypertension, diabetes, obesity. These diseases run together. Macular degeneration patients are sick. Now, macular degeneration, as I mentioned before, as with diabetes, is a nutrition-related disease. The USDA every 10 years or so looks at Americans' nutrition, and they found that 92% of Americans are deficient in at least one nutrient. And they found that 16% of the population, their nutrition is so poor that they're actually committing suicide. And that poor or inadequate diets, related to one of the early slides I showed you, a link to the 4 of the top 10 causes of death: heart disease, cancer, stroke, and diabetes. And unfortunately, about 12% of our population are alcohol abusers. And when you drink alcohol, you deplete yourself in different types of vitamins, such as vitamin C, and you need vitamin C to regenerate vitamin E. vitamin B1 thiamine, which is important for carbohydrate metabolism and glucose metabolism. Here's a study that was done, and I'm going to show you studies, and then I'm going to give you a summary at the end, a 10-point plan to help you prevent macular degeneration for you and your family, that showed that healthy diet, not smoking, and physical activity lowered the risk of macular degeneration by 71%. And healthy diet was unprocessed foods such as organic fruits and vegetables, healthy fats, good quality grass-fed meat and proteins, vegetables, green leafy vegetables, etc. And foods high in sugar, like Dr. Kenobi said, alcohol and bad fats were the villains here. Only what percent, and I know you can't answer me, of Americans follow the 4 basic health principles of not smoking, not being overweight and having that big belly, eating 5 or more fruits and vegetables a day, and exercising more than 30 minutes a week? And the answer is only 3% of Americans follow that. Unfortunately, the Americans' leading antioxidant is coffee, and the leading vegetable of Americans is French fries, if you could call that a vegetable. Now, if you eat like us, you're going to get diseases like us. So macular degeneration, as we said, is a leading cause of blindness in the US, but also the leading cause of blindness in Western Europe, Australia, and Japan. If you eat like us, you're going to be like us. I'm going to get into the risk factors. Risk factors are very important because if you can lower your risk factors, you can lower your risk of getting this blinding disease. I want to tie in together macular degeneration, chronic inflammation, and cardiovascular disease, and also Alzheimer's, because they all run together. So inflammation is a core component of chronic disease. So what causes inflammation? Smoking, having a big belly, because a big belly is an endocrine gland, giving off inflammatory mediators. A poor diet, stress, lack of exercise, and lack of sleep. If you just have one large drusen, so here's a picture of the eye. I don't know if you can see my cursor, but those little, and that's the macula in the middle here. Just having one of those large drusen, which is a breakdown of tissue in the back of the eye, doubles your risk for dying from a heart attack, just to show how these diseases are related. And it's thought that macular degeneration is a form of ocular atherosclerosis. And these little drusen, these little white spots, this breakdown of tissue, is full of ApoE and oxidized lipoprotein. ApoE is something that's involved in protein metabolism and implicated in Alzheimer's. And Alzheimer's and macular degeneration are related. And if you have Alzheimer's, you're at greater risk of macular degeneration and vice versa. Now, we talked about cardiovascular disease, and if we look at cardiovascular disease, what are the risk factors? And the same as we talked about with inflammation, smoking, obesity, poor diet, being sedentary, family history. Now let's talk about risk factors for macular degeneration. And we're going to go into these risk factors in detail, but it's important that people understand. So again, what are the risk factors for macular degeneration? Think of smoking, think of Alzheimer's disease, think of Alzheimer's disease, think of cardiovascular disease, smoking, poor diet, alcohol, coronary artery disease, being exposed to lots of blue light. Females are more common than males, being older, having low macular pigment. And we're going to talk about low macular pigment because pigment in the back of the eye that we get from eating foods that have carotenoids, which are plant pigments. When those plant pigments get deposited in the eye, that protects the macula against macular degeneration. Having blood tests that show that we are at increase in inflammation, such as high homocysteine, also implicated in cardiovascular disease and Alzheimer's, and high C-reactive protein. C-reactive protein is another marker that we can see when we're doing blood labs. Insomnia, also, we talked about lack of sleep with cardiovascular disease, and taking iron supplements. I thought that insomnia was interesting because they presented that at a retina specialist meeting in Vancouver at the 36th annual meeting a number of years ago. Anticoagulants, Coumadin and heparin and antiplatelets, Coumadin, heparin, anticoagulants, antiplatelets, which are like Plavix and aspirin, also increase our risk. Now, smoking affects the small blood vessels in the eye. So any small blood vessels are going to be affected. So not only does this affect the small blood vessels in the eye and different parts of the body, but the picture speaks for itself. Now, I remember as a kid, I used to drive in the car with my father, and unfortunately, many years ago, he smoked, and luckily he saw the light as he didn't get much older, and him and my mother stopped smoking. But I remember rolling down the window in the summer, and they would be smoking and choking in the back seat and trying to roll down the window, and my father getting upset with me because he had the air conditioning on. But secondhand smoke does can increase your risk of macular degeneration. So somebody is smoking, stay away from people who are smoking. And luckily, my dad is still alive, and my mom, and they're great people, and they no longer smoke anymore. So let's talk about alcohol. Alcohol, as I said, about 12.7% of the population has an alcohol problem in the US, and it's associated with an elevated risk of macular degeneration because alcohol depletes zinc, thiamine, and vitamin A. Vitamin A is very important in the eye cycle. Zinc also is very important. If you have, in one of the most important studies in ophthalmology and optometry called the ARED study, zinc decreases the risk of macular degeneration over 20%. But zinc is a very important nutrient because it's antioxidant, anti-inflammatory. And the etiology of macular degeneration, or the cause, is inflammation. Inflammation, again, is the core component of chronic disease. So having that big belly, being overweight, doubles your risk of having macular degeneration. So you want to stay away from high glycemic foods that increase insulin. Insulin causes fat to be deposited in the abdomen. And there are over 50 country studies that show that if you have a big belly, you're at premature risk, not only for macular degeneration, but from dying from cardiovascular disease. If you a diet high in trans fats, 3 times the risk of macular degeneration. High glycemic index foods, so foods that turn to sugar, double your risk of macular degeneration, such as different grains and sugars. Also, high glycemic foods increase your risk of cataracts. We're going to go into what lowers your risk, but I want to bring up olive oil, omega-3s, and eating nuts 1 to 2 times a week. Decrease the risk because they're anti-inflammatory and they have antioxidant properties. The female nurses study is an interesting study. They follow nurses for years, and they find out what are the 5 lifestyle risk factors found to influence death, specifically from cardiovascular disease and cancer. And of course, they're the same ones. We talked about cardiovascular disease, inflammation, smoking, number 1, low physical activity, number 2, overweight, number 3, poor diet, 4, drinking, number 5. Having all 5 of these risk factors, the nurses who would partake in these activities had a 43% increased risk of dying, 8 times risk of dying from a heart attack, and 3 times risk of dying from cancer. Just exercising alone could add 3 years to your life. Here's a test that's done, and this is a test that cheek swab that was popular for a while, and it would show who's at risk from a genetic point of view. If you have a genetic predisposition to macular degeneration. Also, one of the things that the test tells us that's important is it tells us if zinc could increase your risk of macular degeneration, or can zinc lower your risk of macular degeneration, depending on the allele, on the type of genetic, what comes out on the genetic test. It shows whether or not you may be at risk if you're taking high dose zinc. And what can you do to decrease your risk? Well, we're going to get into that in quite a bit of detail. So let's start here with the ARAD study. You can't talk about macular degeneration without talking about the ARAD study, which was done in 2001, and the backstory of the ARAD study, which again was released in 2001. It was about to be released, and then 9/11 happened. So they waited to release a study, but what it showed that it showed a relative risk reduction of macular degeneration by 25% by taking antioxidants plus zinc. But zinc alone decreased the risk by 21%. This had no effect on cataracts. One thing that's important is that there's a in the studies that they do, now there's an NNT number. It's called the number needed to treat. So the number needed to treat with ARADs is only 24. So that means 24 people need to take it, and one person will get a benefit, which doesn't sound great, but it's actually not that bad when you look at statins, which is around anywhere between 150 people to 200 people, depending on when you look at. So what's in the ARADs formula? I think many of you are probably familiar with this: vitamin C, vitamin D, beta carotene, zinc, and copper. They have to add copper because zinc, if you have too much zinc, could displace copper off the hemoglobin and cause an anemia. The body could only absorb 40 milligrams of zinc. So in my opinion here, 80 milligrams of zinc is way too much. And there were some side effects from having that much zinc, such as urinary tract infections and some GI upsets. So now they have lowered the amount of zinc in the ARADS formula. But if you look at that study that we talked about before with the macular risk, some people, if they have a complement factor H allele, taking zinc could increase the risk of macular degeneration. Although there is some controversy in that statement. All right, so what's the punchline? There are 8 million people at risk for vision loss, for macular degeneration. If everybody took antioxidants or the ARADS formula, 300,000 people's vision could be saved in 5 years, but we could do better. And we're going to talk about that. That's what macular degeneration looks like. That's category 3. If we have just one large drusen, you're at risk for getting macular degeneration and going blind from macular degeneration. That's advanced macular degeneration. This is the atrophic atrophy. If you can see my cursor at the bottom, and this is the wet kind with the blood. So if you have this one large drusen in 5 years, you have about an 18% chance of progressing to advanced, so losing vision and at least one eye, and almost a 50% chance if you have blindness in one eye to get blind in the other eye. So then there came ARADS 2, which added to our knowledge. And what they did was they lowered the zinc to 40 milligrams, and they added lutein and zeaxanthin and omega-3s. So what do we find if you are low in lutein and zeaxanthin, which is about 98% of the population? You add an extra 18% to decreasing your risk of macular degeneration. So from 25 to 46% decrease, 48% decreased risk of macular degeneration. They found in this study that omega-3s had no effect, but there's plenty of studies that show that omega-3s have a very important effect to decrease the risk of macular degeneration. You know, that's one thing about studies. You know, there's always different studies, and you could always get whatever you want in your study depending on how you do it, what type of omega-3s they use, and which is good because people could make up, and doctors could make up for themselves what they want to recommend to their patients. We talked about the macular pigment in the back of the eye. That's the macular The macular pigment is protective. So we get that macular pigment from these carotenoids that we eat. You could think of as internal sunglasses, protecting the back of the eye. So that macular pigment is identified as zeaxanthin, mesozeaxanthin, and lutein, and the macula protects different cells in the back of the eye, cells called photoreceptors, retinal pigment epithelial cells, which die and break down in macular degeneration. So carotenoids that we get from nature, from eating different plants, there are 800 in nature. There are 15 in the blood, which are in the plasma in the blood, which are very important because the whole idea is we could eat it, but if we're not absorbing it well, we're not going to get the benefits of the carotenoids. And there are 3 in the eye: lutein, mesozeaxanthin, and zeaxanthin. These carotenoids, not only are they important for decreasing the risk of macular degeneration, but they also help in decreasing risk of cardiovascular disease and cancer. And that's where we get our carotenoids. They're in nature because they decrease photo damage from light for plants. So in the center of the macula, there's lutein, mesozeaxanthin, and zeaxanthin, and they're at a 1:1:1 ratio. So it's very important that we get that. So where do we get zeaxanthin? We get it from egg yolks, orange and yellow peppers, nectarines, papaya, honeydew, most from something called goji berries, which we'll talk about in a minute. Mesozeaxanthin is not so much in your food supply. We need it to be converted from lutein, but it's a little bit in some of the, such as salmon skin and in trout. Lutein we get in kale, spinach, collard greens, etc. Goji berries, which is common in the Asian population, as you can see, that look at all the zeaxanthin in goji berries. So I try to have goji berries on a daily basis, but not only is there zeaxanthin, there's 18 amino acids, there's 12 trace minerals, there's more vitamin C in goji berries than there are in an orange for vitamin C. So lack of macular pigment, there's an increased risk of macular degeneration. We want to increase that macular pigment. That's macular degeneration. And these are studies that show that you need that without macular pigment, you increase your risk of, or with low macular pigment, you increase your risk of getting macular degeneration. I did a very good podcast with John Nolan. He does a lot of research on this at Waterford, in Waterford, Ireland. Please tune into that. Dr. Joanna Seddon, back in 1994, she's one of the pioneers in research in nutrition and lowering your risk of macular degeneration. She found foods high in lutein and zeaxanthin lowered the risk of macular degeneration by about 43%. Also lowered the risk of cataract formation. But subsequent analysis of people who eat a lot of spinach, of course you want organic spinach, decreases their risk by 86% of wet macular degeneration. This is a fascinating look at her research, and you can see the percentage risk of macular degeneration on this axis here. And here you can see the more spinach or the more lutein and zeaxanthin, foods with lutein and zeaxanthin that you're eating, you decrease your risk. But one of the most fascinating slides is this one. This is complicated, so I'll try my best to explain it. But here's the odds ratio, if you see my cursor, of macular degeneration here. Here's the amount of lutein and zeaxanthin that you're eating here. And here's smoking. So it's complicated because there's 3 different parts to the study. But what it shows that for people that smoke, eating high amounts of lutein and zeaxanthin is protective. Now, I'm not recommending that you smoke, but if you do smoke and you can't quit, eat foods that are high in lutein and zeaxanthin and mesozeaxanthin, or take supplements that have it. The Mediterranean diet significantly reduced the risk of macular degeneration by 41%. This was released in 2019 in Ophthalmology. And the Mediterranean diet, I'm sure most people know, is nutrient-rich foods high in fruit vegetables, beans, and fish and staying away from processed foods. And the standard American diet or SAD diet, as I said before, only on any given day, only 2% of Americans eat any green leafy vegetables. Now, this is very important because this is talking about zeaxanthin and lutein in your serum, so how well we're able to absorb it. And here's a study that showed that there's a 50% reduced risk of early and late macular degeneration with high levels of zeaxanthin in their plasma. But this study shows 93% reduction of macular degeneration if you could get zeaxanthin into your plasma, and a 77% reduction in cataracts, where lutein was a 79% reduction in macular degeneration, but no association with cataracts. And here's a study, another in the Chinese population that was done in investigative ophthalmology that showed a 96% risk reduction of exudative macular degeneration with dietary zeaxanthin if we could get it into our serum, and 78 with lycopene. We don't hear much about lycopene. We hear about it for prostate cancer. We don't hear much about it for macular degeneration. And the ARADS group, which does lots of studies, and they're constantly studying this group of people, show that dietary lutein and zeaxanthin less likely to have macular degeneration, 26% less likely to have those large spots called drusen, 35% less likely to have the wet macular degeneration, and 55% less likely to have the geographic, which is that bad dry macular degeneration that causes blindness. The Blue Mountain Eye study, high dietary intake of zeaxanthin and lutein reduced the risk by 65% of neovascular macular degeneration. Also said that beta carotene increased the risk of wet macular degeneration. So because beta carotene, we feel, competes with lutein. So if we're going to take beta carotene, we don't want to take it at the same time as lutein. But it also confirmed that zinc decreased the risk. But the studies show you want to stay less than 25 milligrams of zinc per day. Dr. Stu Richer, who's a good friend of mine and most prolific researcher in optometry, is responsible for the most research studies, did a study where he gave 12 months, 10 milligrams of lutein. So these were pills, 10 milligram lutein pills. And after a year, it improved macular pigment, that we talked about, that important pigment in the back of the eye, increase your visual acuity. So when you look at that eye chart and you go to the doctor's office, you're able to see 5 letters better, improve glare and contrast. Now here's foods with lutein and zeaxanthin. If you want to take a quick look at that, what foods have a lot of it. I did a podcast with Dr. Richer. Please tune in. NHANES, Dr. Julie Morris, a PhD, she found that analysis showed that consuming 6 milligrams of lutein and zeaxanthin decreased the risk of macular degeneration by about 40%. So you could see that we have anywhere between 40% and as high as 90% decrease the risk depending on how much you absorb. That's why I'm a big proponent of taking a digestive enzyme before you eat to help with the absorption of these vegetables. Well, how about vitamin D? There's been studies on vitamin D to show that vitamin D decreases the risk of macular degeneration by about 40%. Remember, we talked about macular degeneration being the cause being inflammation being the core component of chronic disease. And vitamin D is an immune modulator, which decreases pro-inflammatory cells. And there's also studies with vitamin D, people with low vitamin D at increased risk of all-cause dementia and Alzheimer's, and increased risk of impaired glucose metabolism, increased risk of diabetes and hypertension. And there's some more studies that show a 59% lowering your odds of macular degeneration with vitamin D. Having vitamin D, the optimal vitamin D level is between 50 and 80 nanograms per ml. And the only way you can know that is by doing a blood test. We talked a little bit about exercise. Exercise decreases your risk of cataracts and macular degeneration. So running 2.4 miles, 42 to 54% lower the risk of macular degeneration. And there's 3 additional studies to confirm that. Also decrease the risk of cataracts. Oranges reduce the risk of macular degeneration. So people that ate an orange on a daily basis had a 60% lower risk of macular degeneration. And oranges don't have a lot of lutein in it, only 187 micrograms, and zeaxanthin 244 micrograms, but also, as you know, has a lot of vitamin C. Egg eaters, people who consume 2 more eggs per week, reduce their risk of developing neovascular macular degeneration by 62%. Okay, let's talk about, I left this, I was a big Superman fan when I was a kid, and that was, to me, that was Superman, George Reeves. But of course, that was many years ago. So not only can macular pigment decrease your risk of macular degeneration, but it improves your good vision or regular vision. So if you're having trouble with glare, increasing your macular pigment, or as we call MPOD, and we can measure that with an instrument called a quantify. In my office, we measure macular pigment. So you could also decrease your sensitivity to light. Who remembers going into a movie theater and it's dark, going out and being very dazzled by the light? Macular pigment decreases the risk of that. Now, I don't want to say that macular pigment is the only, low macular pigment isn't the only thing that causes glare, because cataracts can cause glare and corneal problems, but certainly macular pigment can cause glare. And the glare, also being very sensitive to light, something called photophobia. The more macular pigment, the less risk of being sensitive to light. And here's a trial where they use tablets. They use MacuHealth, which is lutein, zeaxanthin, mesoxanthin, plus the ARADS formula. And they showed that you increase your contrast and photostress recovery time. I'm very interested in helping good vision, making good vision even better, because I have a son who plays baseball, as you can see him here on the left, and eating foods with lutein and zeaxanthin, and taking pills, vitamins with lutein and zeaxanthin, increases visual processing. And when you increase visual processing, you could react to a baseball about 10% faster when hitting. And this is just some research to back it up. Also, using supplementation with lutein, mesoxanthin, and zeaxanthin decreases your symptoms on a computer, your sleep, your visual symptoms, such as headaches and eye strain on a computer. So computer strain is helped by increasing your macular pigment. So healthy vision is helped with macular pigment, going from light to dark, light sensitivity, seeing at dusk, so which is important for driving, being able to see in sports, it's very important, and helping with computer fatigue, which most people are on a computer. And it's also very important in driving a car, because there are studies that show that if you increase your macular pigment, you could recover twice as fast if you get dazzled by a light, which means that you could see up to 400 feet sooner. So for driving safety, it's very important. I did a podcast with Dr. Jim Stringham on this very topic. Tune in. I think you'll enjoy it. Just a quick word on cataracts. Inside the eye is a lens. If it gets opaque, that's called a cataract. And lutein and zeaxanthin decrease the risk of cataracts as high as 32%, and some studies as high as 50%. And vitamin C also decreases the risk of cataracts. So I want to talk about lutein again and just review it. So we know that lutein decreases your risk of macular degeneration. It also is deposited in the brain and helps with cognition. It also decreases the risk of cancer and improves cardiovascular health. And if you to find out more about this, tune into my podcast with Dr. Lisa Renzi. Soon, the optometrist may be the first doctor who's going to help diagnose Alzheimer's sooner, because we have incredible instrumentation in our practices, and we can see the smallest blood vessels in the eye, which are similar to the brain. So when we lose vascular density, it shows that you may be starting to get Alzheimer's. So look for that new research, that we're very early in that research. And there's a book called The End of Alzheimer's by Dale Bredesen, and he talks about different things you could do to decrease your risk of macular degeneration, different ways you could do to decrease your risk of Alzheimer's disease. But he does talk about the relationship between Alzheimer's and macular degeneration in the podcast. Omega-3s. Everybody's very interested in omega-3s, but the important ones are the ones from fish, not the ones from plant. The plant ones are the ALA ones. We're interested in the EPA and DHA. Now, some ALA from plants do convert over to EPA and DHA, but it's very small amount. So you want it in you want the fish kind. Of course, you want fish that are high in omega-3s, such as wild salmon, sardines, because it's a small fish and there's not as much mercury, and mackerel. So you have to be careful with the mercury. So let's talk about macular degeneration and omega-3s. So here's one study that shows that people who eat high foods or take supplements and omega-3s were 30% less likely to get advanced macular degeneration, neovascular or geographic atrophy. Now here's a meta-analysis where they take 9 studies together, 88,000 people, and they're showing that a high dietary intake of omega-3s reduced the risk of macular degeneration, late macular degeneration, by 38%. And they felt that fish intake at least twice a week was sufficient. Now, as we wrap up, we need macular degeneration. Unfortunately, 40% of the people that present to the eye doctor's office are legally blind from macular degeneration at the initial time of diagnosis. So we need early diagnosis, and we need ways to be able to detect who's at risk. So these are some of the instruments that we talked about before. Here's the macular pigment test that I talked about, and this is the retinal camera. And now there's a test where they put you in they look at your dark adaptation, and dark adaptation tells us if you're getting macular degeneration sooner. Pictures of macular degeneration. This is a picture of multispectral imaging compared to regular picture of the macula, and you can see this type of retinal imaging, which I have in my office, could pick up early changes of macular degeneration a little bit sooner than standard fundus camera. What's the earliest symptom of macular degeneration? Earliest symptom of progression, and that's where all of a sudden you're noticing your night vision not as good. Although your night vision might not be as good because you're starting to develop astigmatism. When you have astigmatism, your night vision isn't as good either. So Mark Twain said, it ain't what you don't know for sure that gets you into trouble. It's what you know for sure that just ain't so. And it takes 17 years for doctors to bring research, 30% of the research into their practices. And a lot of what I showed you is some of the newest research from over the last 5 or 6 years. And only, believe it or not, 17% of what doctors do is actually backed up by research. So here's my 10-point plan to help protect you and your family. Number 1 is avoid smoking. Avoid foods that are high glycemic that turn, those are the white fluffies that turn into sugar very quickly. We want optimal fasting insulin levels between 2 and 5. And the only way you can do that is with labs. I mean, that's ideal. We want to avoid high fructose corn syrup, sweetened drinks, artificial sweeteners. But what's okay is D-ribose, if you need a sweetener, or Lohan, or non-bulk stevia. We want to avoid anything that causes inflammation, like dairy or grain-fed meat. Grass-fed meat is fine. trans fats. We want to eat foods that are high in omega-3 or take supplements such as wild salmon, sardines. Mackerel, we have to be careful about the mercury levels though. We want to be on an anti-inflammatory diet. So we want a 3-to-1 organic vegetables to organic fruits, raw unsalted nuts and seeds, grass-fed hormone, and antibiotic-free meats, organic and hormone-free turkey, chicken, eggs, including the yolk from pasture-fed hormone antibiotic-free chicken, healthy fats such as avocado, olive oil, raw and unprocessed coconut oil, unprocessed coconut, organic coconut oil, best for cooking. We want to eat foods that contain lutein and zeaxanthin, such as the dark green leafy vegetables, the goji berries I talked about, egg yolks, orange and yellow peppers. We want to drink 1.5 liters of water a day with organic green tea in it. Organic green tea is anti-inflammatory. Same with spices. A lot of spices on your food. They're anti-inflammatory. They're antioxidant. You want to make sure your vitamin D levels are between 50 and 80 nanograms per ml. You could take vitamin, if you can't get out in the sun for safe sun, you could take D3, K2, probably 5,000 D3 a day with K2, whatever comes with it. The reason why you want vitamin K2 is because vitamin D does a lot of great things, such as decreasing your risk of 16 different types of cancers, decreasing the risk of macular degeneration, but also vitamin D can increase the risk of calcium into your blood vessels. Vitamin K2 prevents that. That's why the good vitamin companies are putting them together. Supplements for ocular nutrition. We also good sleep. We want a high quality multivitamin because we want the B vitamins because if you have high homocysteine, the way to lower it is with B vitamins, a B complex. Probiotics and enzymes. You know, there are different eye supplements. MacuHealth has been tested. I Promise Restore has been tested to show that they have in it what they say is in it. Sometimes you buy these things from these supplements from the drugstore or the vitamin store, and you don't know what's in it because the vitamin industry is like the wild, wild west. Zeaxanthin. People ask me about astaxanthin. You know, I think it can't hurt. I don't think there's enough research to say that I could recommend astaxanthin. There's some good books to read, such as The Paleo Diet. Wheat Belly is a good book to read. Dr. Perlmutter has some good books. I'm often asked, what are my non-eye brands for supplements? So if we're looking at a multivitamin, this is what I like. Designs for Health, I think they give very quality vitamins. Zymogen, Life Extension, Biotics are very good for cardiovascular. Claire is good vitamins for probiotics. Thorne and orthomolecular. And I want to conclude with this. We're going to send out a free link so you could watch our movie. Our movie is in the queue now for Amazon Prime. Open Your Eyes. So look for that, but you'll be getting from the society the free link, and watch our podcast, the Open Your Eyes podcast with Dr. Kerry Kelp. Thank you, and I'll be happy to entertain any questions. Okay, so first one, I think this is the first one. What supplements do you recommend? I think I cover that. But again, I like for the eye, I like MacuHealth because it has lutein, zeaxanthin, and mesozeaxanthin. That's my favorite. But there are other good ones. There are other good ones as well. I also like to layer on top of it a multivitamin that has the B vitamins. I like to use vitamin D3 and K2. These are all things that I take myself because we know, and omega-3s, we know that these all decrease the risk of macular degeneration. Omega-3s, I actually am brave enough to take the liquid. I use the Designs for Health brand. I think that's a very good, it doesn't taste fishy at all. So I like that. During eye exam, what medical problems can the doctor see? So you could see up to 300 systemic disease from doing an eye exam, from the front to the back, anything from that are common from, unfortunately, cancer to brain tumors to diabetes to hypertension. So it's very common to see because we could see the capillaries. So it's very common to see systemic disease from the eye. Many times, a lot of autoimmune disease happens in the front of the eye. So we could many times pick up lupus and sarcoid. These are things that we'll pick up. Can a person with macular degeneration over 80 benefit from changing their lifestyle? I think people from over 100 could benefit from our lifestyle. Make sure you watch our movie, because we interviewed the centenarians and we look at why they lived over 100. So you could turn your lifestyle over at any age, of course. Where can I get the genetic test done? There are certain doctors, you have to call them to see. It's called macular risk, to see if they do the genetic test. How much zeaxanthin and lutein should I get daily? So that's a great question, because nobody knows the real answer to that, because there's never been studied exact. But we like it. 10-10-2 is what MacuHealth has in 10-10-2, which is 10 lutein, 10 meso, 2 zeaxanthin. What if you just don't like fish? Can you correct the amount of omega-3 and how much should you take? Yes, take omega-3s. Take between 2,000 and 4,000 a day. If you're already on blood thinners, make sure you okay that with your doctor. You did not mention Bausch Shalom, AREDS. Bausch Shalom is good, but I think we've been able to show from studies that we could even do better than AREDS. We could do better. AREDS is good because we're at 25%, and with AREDS 2, we're at 30, with 35, 45, 43%. But I gave you examples where we could get close to 90%. Does good diet and supplement help with myopic macular degeneration? That's a good question. And I would say good diet and supplement helps with everything, but I don't know any research to show that, so I can't answer that question.
We want to thank you so much, Dr. Gelb, for coming on today and giving us this information. We also just want to make sure that everyone knows that you will be receiving a link to the video Open Your Eyes with Dr. Gelb. So please keep track of your emails. If you attended today, you will be receiving that. Otherwise, I want to thank you so much for attending, and have a great day.